Hi, I'm Dr. Kristen Northup. I am a psychology postdoctoral resident at MHCA. I currently do therapy, neurofeedback, the comprehensive diagnostic assessments, and one area I specialize in is trauma and trauma-informed care. Trauma has traditionally been defined as exposure to a real or threatened death, serious injury, or sexual violence. But what we're kind of seeing now is people are coming in for treatment and we're seeing various types of trauma. And so we mostly look at that as any kind of event that's distressing to a person. And that could be growing up in a household with someone who has a family member with mental illness. It could be poverty, racism, having strict parents. We're seeing a very wide variety of what a traumatic event could look like. So because trauma can be complex and impact various bodily systems, a lot of times you might experience physical symptoms. So that could be like gastrointestinal upset, headaches, fatigue we see a lot, sweating, just kind of those more physical manifestations of trauma. We also see emotional symptoms, so anger, irritability, anxiety, depression, and then cognitive symptoms as well. On a treatment plan, we typically would recommend psychotherapy, and so that's going to be with a trauma-informed provider. Knowing how to help someone recognize, patterns in the nervous system, or being able to identify trauma and empowering them to kind of build upon their own strengths. Neurofeedback is often used as an adjunct to therapy and medication, so in addition to. It's very non-invasive. Someone's hooked up to an EEG. We're basically on a feedback system, so that EEG is reading their electrical brainwaves, sending a signal back to us, and then based upon what it's reading, it's sending a very, very low-grade stimulation to the individual's brain, and it kind of helps disrupt dysfunctional patterns of thinking, which is something we see very often with trauma. So what we kind of want people to know is that, while trauma can be a very difficult experience, we do see very positive mental health and health outcomes related to trauma. And so it's important that people know there are providers in the community who can do trauma-informed care and ultimately help people live a better life.